Well, your job when you do get home, take it easy, don't overdo it.
On any given day, Josh Beardsley is talking to patients, discussing policy with colleagues, and in the thick of things in the operating room.
So I grew up knowing I was probably going to be a PA. My dad was a PA. He was actually one of the first PAs in the Navy.
Josh is a PA in neurosurgery, and with more than a decade of experience under his belt, his skills are well honed.
And depending on the surgery, we can be operating shoulder to shoulder. There's some operations that require surgery be done on both sides of the patient, where I'll actually do my side of the procedure and Josh will conduct maneuvers on the opposite side.
Other surgeons who have worked with Josh have similar confidence in his abilities.
He is, someone who's really at his core can do almost anything a physician or a surgeon can do, and so working with him at times is even more. It can be more rewarding than working with one of my partners. My experience with working with Josh has just been fantastic in terms of his competence level, his energy level, and his patient care. At the end of the day, he's fantastic with the patients.
Cold hands again. You must.
I know.
You must have a warm heart.
Well, that's actually one of the greatest things about my job, and one of the things I love about neurosurgery is I do get to interact with patients who are usually at their weakest or worst points in their life. If it's a spine issue, we usually help them feel better with surgery. If it's a brain issue, then it's just an opportunity to interact with a patient on a very different personal level.
He can see a patient in the hospital who's just gotten not so great news and talk with them and form a comfort level with them that gives them a little more peace of mind than they otherwise would have. And he's probably a little bit better at that than I am.
Big muscle, arms up like that, push up, push, 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 good.
The care and attention Josh gives patients extends to healthcare staffers.
They oftentimes have a greater rapport with patients, with nurses, with secretarial staff than we do as physicians.
He says to all of us, if you ever need anything, you can always page me, always call me. I'm always willing to help, whether I'm on call or not, whether I'm here or not. And he totally follows through with it every time.
That level of dedication is one reason Josh was promoted to help manage more than 24 PAs at this practice, one of the largest in the nation, where the respect between doctors and PAs is mutual.
There's a line that shouldn't be crossed, and Josh and all the rest of our PAs know where that line is, and that's why our physicians respect what they do, and they trust us, and they give us as much responsibility and autonomy that they do.
Hospital administrators are also increasingly seeing their value.
We very much work as a team with our PAs. We have some that see patients independently, some that see patients primarily with the surgeon, some that operate. We have multiple different roles, and we keep finding new roles.
And so does Josh. He is now president of the Association of Neurosurgical Physician Assistants, or ANSPA. But recently, his ability to participate in surgery was put in jeopardy.
There was a proposal through the AMA, and it would basically limit a PA's ability to do any kind of invasive procedure or procedure that would alter the skin, which is pretty much anything. It could have been, sewing up a laceration, or, washing out, an IND in the office, or closing a wound in the OR. And through leadership of the AAPA, and then with leadership of other constituent organizations like ANSPA, myself included, we were able to formulate a draft and come up with options. And it basically explained, if you pass this, this means that PAs won't be able to function in the capacity in which we currently function.
The AMA eventually amended its proposal, but only after extensive outreach efforts.
So the AAPA definitely was a big player in preventing what could have been a catastrophic issue.
Close calls like that firm up Josh's resolve to stay engaged and build relationships with other professional organizations. He's currently involved with both the American Association of Neurological Surgeons and the Congress of Neurological Surgeons.
The Congress of Neurological Surgeons, or the CNS, has been a big supporter of ANSPA. We work together on initiatives for PA training and education.
As physicians find themselves stretched to do more and more things, having a PA or several PAs can really enhance efficiency of healthcare delivery, particularly that team of PAs and physicians are working seamlessly together.
Neurosurgeon Mark Smith experiences that benefit daily as he works with Josh Beardsley.
In a typical operation, I would say he makes me 30 or 40% more efficient. And he makes me a better neurosurgeon. And hopefully I make him a better neurosurgical PA just based on that give and take that we have.
But it's more than just that.
So we have that professional collegial relationship, but we also have a friendship as well, which to me is important.
It's a team approach that increases satisfaction for both patient and provider.
Without them on the front line in helping care for our patients, our group simply wouldn't have the success that we've had over the years. And so for us here in Charlotte, it doesn't take a brain surgeon to know that we need PAs in our group.